regarding my study is going to be on myofascial release and the fascial lines in the dynamics of cricket. It's a narrative study. And I hail from Sri Ramchandra Faculty of Sports and Exercise Science at the Sri Ramchandra Center for Sports Science at the Srihar, Dean University. The need for the study was to get an insight into the fascial system in the human body, to understand involvement of fascia in cricketing actions and its potential for injury. As an introduction, the human body is ever unpredictable, with the variety and flexibility shown in adaptation to movements and even more to the far extent of sporting skills. In athletes, the fascia is being addressed therapeutically for dysfunctions of the spine and extremity, though diagnostic criteria are not very clear. Fascia is made up of sheets of connective tissue that is found below the skin. These tissues attach, stabilize, impart strength, maintain vessel patency, separate muscles and enclose different organs. The fascia attach, stabilize, and the classification system of the fascia can be classified as superficial, deep, visceral or parietal, and further classified according to the anatomical location. The aim of the study was to understand the relationship between the fascial lines and the physical movements involved in cricket from the existing literature. The method's 26 articles related to the above topic were reviewed from 3 databases: PubMed, Google Scholar, ResearchGate, using the keywords movements in cricket, fascia, myofascial release technique, fascia related dysfunction. It was a narrative review conducted at Sri Ramchandra Center for Sports Science. Now coming to the discussions, while addressing the physical dysfunction somatically, the biomechanical model has often found preference, and the fascia usually has no place in the biomechanical model. Various manual therapeutic methods find place in the treatment of facial dysfunctions, which most of my physio colleagues here would definitely agree. And myofascial release techniques is commonly used over the years. In the recent years, the fascial web and the extent of the interconnected fascial lines have gained more attention. And yesterday from Nitin Patel's talk, we would have listened to the application of tensegrity. So a tightness of a fascia at one end of the body can reflect at restricted mobility at another end. In the past, though the fascia was subject to changes through different modes of stretching and other intervention of late, there is a direct focus on the fascia as a structure under diagnosis and therapy. As a result, the multiplanar actions of cricket can definitely benefit from a fitness perspective as well as from a therapeutic angle for optimal and enhanced sporting performance. In this study, we have worked on understanding the fascial lines involved in the different batting and bowling actions. This may help in prioritizing the fascial lines opted for treatment in management of musculoskeletal dysfunction, specifically in cricketers. Now, to give a small gist of what exactly we are dealing with, we can consider a bed sheet that is tucked into the mattress. If you try to crumple the bed sheet on the one end, and you can see the bed sheet getting tightened up at the other end. And if you look at the human body, an anatomical model, if the fascia is tight on the calf region, the patient may perceive pain or rather tightness in the lumbar region. So hunting for somatic model at the lumbar region would usually be less fruitful. Rather, a release of the fascia around the calf or rather even the plantar fascia can give very fruitful results. So that's the gist of what facial manipulation is all about. The myofascial meridians describe the lines of fascia whose tension runs through the body surface, assisting to keep the shape and flexibility and control during the movement and maintain overall posture. The fascial lines approach provides a traceable basis for effective treatment at some distance from the site of dysfunction or pain. This view of structural patterning has far-reaching implications for treatment strategies, especially for long-standing postural imbalance, unsound body usage, and sequel from insult or injury. Now, as per Thomas Myers, the facial lines, these are the facial lines of which I would say the back facial line, the number 9 and 10, the back functional line and the front functional line see a lot of involvement in almost all the cricketing actions. And I would also like to emphasize on the analysis, the short analysis done by us in the uppercut shot. The facial lines, again, you see that there's a lot of superficial back line which is being taken to task, and in the straight line, again, you have the superficial front arm line. So most of the batting actions, you have the lateral lines and the deep functional line as well as the superficial functional lines getting into the action. And also to say, like the facial lines may not be directly involved, but rather you might see there is a tightness of the muscle, or when the muscle is injured, when it goes in for protective reflex. It's not just the muscle, but rather it is more the what we see is the muscle along with the tightness action of the muscle. You also see the fascia getting pulled into the action, and we always wonder whether it is the muscle actually which is injured or it is the fascia encircling the muscle which is injured. So in that case, handling a muscle which is injured and handling a fascia which is injured is going to be extremely different, because when it comes to a muscle, we can go in for deep manipulative techniques, but when it's the fascia which you handle, you have to go in for a very gentle technique where the amount of stretch that you would give is up to the first resistance that you would feel when you give a gentle stretch, and nothing more than that. Whereas when it's a muscle, you can definitely go in for a deeper stretch. And the various facial lines that we have come across in the batting action and as well as in the bowling action. In the bowling action also, I have to admit that when we went through this, we found most of the bowling actions of a pace bowler being similar, not the action similar, but the facial lines, engagements being similar. But a lot of variations were seen in the finger positions in the release of the ball, and this also would definitely have a lot of involvement in traumatizing the fascia in those people who are prone for it. So coming to the conclusion, considering the facial lines and incorporating the same to the regular fitness regime of the cricketers can add to their flexibility, help maintain or demonstrate better performance, and will also help in injury prevention. Thank you.